Newsfirst, Newsline.
Hello there, a very good evening and welcome to another edition of Newsline. We are living in the new normal, of course, with the COVID-19 pandemic here to stay in Sri Lanka and, of course, across the world. However, we cannot stop moving forward. Schools have begun to reopen. Children are now going to schools and, of course, they are facing a risk of contracting COVID-19. However, guidelines have been put in place to ensure that the spread of COVID-19, especially among children, is kept at a minimum. But what really has been the impact of COVID-19 on children in society? Have they been the most affected by this pandemic that has hit the world? To discuss these matters and more, we have with us today in our studio Senior Professor in Pediatrics at the Colombo University and Consultant Pediatrician at the Lady Ridgeway Hospital, Professor Prof Vikrantha. A very good evening, Professor, and welcome to the show.
Thank you.
Of course, Professor, schools are reopening. That is the latest update and, of course, good news for a lot of children who have been staying at home. But the question still remains, is it safe for children to go to school? A lot of parents are worried about the safety of their children. Can parents really send their children to school?
Well, of course, I must say that opening schools there is a certain amount of risk. But of course, keeping the schools closed also for an indefinite time poses a much more bigger risk to the children. So we have to look at it two angles and see how it is going to affect. Because keeping the schools closed has really affected the children, although true that they have been following their school curriculum to a great extent and covering their syllabus. But of course, school is not just only a place where you get the knowledge. It is much more a place where you experience a lot of things. And for children, I think that is the second society after their family, immediate family, they stepped into. So they develop a lot of interactive skills, soft skills, how to make friends, how to interact, how to behave in differences, things like that. As well as then certain skills are developed which you actually can't give it over the internet or any other distance learning method. So those are some of the things that really keeps important to get a child going into the school.
But Professor, since schools have been reopened, there have been a number of cases of COVID-19 contractions from schools that have been reported. Now, we also know that although the number is very small, there are children who have passed away due to COVID-19 in the country. So this risk can't be mitigated any further? Is bound to be a couple of cases in schools.
Yeah, naturally, because even in the society it is there. And of course, what happens is because with their contact tracing, you go and check them. But of course, all over the world, when we look at the data, the effect on children is very minimum. So that's why even the vaccines are not being trialed in children at the moment. But of course, what is important is that you take maximum precautions when you take the children to the school and then do it. Because, I mean, even then, of course, because it is in this community, you don't know who is having it, who is not having it. So, but the best way to prevent it is by observing the precautions that what you have to take in order to avoid the infection. So, I think, I mean, having said so, sending the children to school, although there is always a risk of many factors, even if there can be a diarrheal disease outbreak, any other respiratory tract infection outbreak. But you take the precautions and you send them to school is important, because otherwise keeping them away from school is the detrimental effect. Now, for example, even they would become physically inactive. That is one of the biggest problems, because they will have poor bone health, they will become obese, and then related problems, because we know that obesity related problems like diabetes and heart disease as well as liver diseases are on the rise in this country. Then of course the effects of the screen devices, even the effect on the eyes, the brain, those are not calculated at the moment. So I mean, facing those, the balance shift more towards sending the children to school, and then of course making sure that we take the precaution, because majority of schools in this country, more than 76% of the schools in this country have only less than 500 students per school total.
Right.
So that means there is a reasonable amount of distancing. But of course, the teachers, parents, other authorities have a huge responsibility to make sure that you give the minimum chances of contracting the illness. But overall, it is very important otherwise.
Also, once students start going to school, it's not only the students that are at risk of contracting COVID-19. If there is a transmission of the virus to the children, of course, the parents too are at risk. What are the guidelines that have been issued on how to deal with students once, of course, the parents start sending them to schools?
Yes. All the guidelines actually for anybody, it was published in the paper some time ago, as well as it is available in the website of the Ministry of Education. Then on top of that, having said so, the important thing is that you have to make sure that the child wears a mask all time. If the child has any difficulty in wearing such a mask, it is advisable to keep a face shield. If somebody prefers both, it is much more better. Then of course, once the child returns home, you should make sure that the child returns, either if preferable if the child can walk home, that is the safest with a parent or an adult. Or if they could cycle, or if they are maintaining any other transportation, if the private transport is available, that would be the better. Or even if they have some form of a common transport to ensure that the distancing and all other precautions are maintained. And that's what I think should be happening. Then once they return home also, you should make sure that you get them wash themselves. Best thing is to remove clothes outside, clean yourself and get in, and also to make sure that the shoes as well as the school bags are kept clean or kept outside. The important thing is once they come in, or if possible, always to make sure that the elderly population is not really present in the house if possible. If they could be moved to some other relative place, or within the house even they could have some amount of degree of separation, that would be the best thing that could adopt, because the danger is even if the child carries it, he would be most of the time asymptomatic, and then he will be just, or may get a very, very mild illness, he will get cured with that. But the danger is if they transmit into the grandparents or adults, adults in the sense the old adults, mainly the grandparents, that age, maybe above 60 or so, mainly, or anyone else who has other morbidity problems like diabetes or cardiac diseases, hypercholesterolemia, that type of thing. So make sure that does not happen. Then of course may have to advise children not to share the food. Best thing is you prepare the food at home, send it to the school with the child, tell has his or her own lunch box as well as the water or whatever drink, and then come back without sharing the food. And of course the teachers also should supervise that, not letting
children share the food.
And of course even the seating arrangements at school have been changed, especially because the primary schools we know they sit in groups. Now that has been also changed into one direction sitting. So then even if you sneeze or cough or anything, it would, because sometimes when they eat, they will be removing the mask.
Yes.
In anything happens at that particular moment, that also to be minimized, that is the best way. Not to face each other or to face them each other at minimum times, and also always to keep on wearing a mask. Even when they talk, sneeze or whatever, it should be behind the mask. So those are the most important precautions that they should be taking, and taking all that, I think it is important that we caution, because we don't know how long this is going to be. So are we going to stay at home for the next 1.5 years? We can't move on like that, because very, very valuable. Already children have lost almost 1 year of their life in that sense.
Well, when the COVID-19 pandemic began here in Sri Lanka and schools started launching distance learning programs, some parents saw this as a viable alternative. And even now, when there are certain guidelines put in place and schools are given an option of either reopening and allowing students to come to school, in-person learning, or also to opt for distance learning programs. There are some parents who actually prefer distance learning programs. Is this continued distance learning programs better for students given the current situation in the country?
Well, the thing is this, there will be distance learning now. We also work in the university. I am also a lecturer in the university.
Right.
So I know, I mean, transmission or giving the certain amount of information, it's a fantastic way. It cuts a lot of cost, unnecessary traveling, unnecessary contamination, all that. But when you come to the point of learning certain things, especially skill development, you can't do, because it is more or less a monologue. If at all, it will be a slightly smaller component of a dialogue when you are doing distant learning methods. It's not the interactive learning that you have. Team building, developing those skills, all that will be gone. So, I mean, we know that the children are just starting their lives. They are just starting to learn. And in that process, these soft skills are very, very important for them. So, the opportunity that you get through distance learning is very minimum. And now even in university education, we can see the interaction we have with the student community is very, very minimum. We can't actually have small group discussion because it is much more, it is a point where you try to clarify yourself to make sure that you really understand. So, the deliver should be able to ask questions one by one. So, that interaction is not taking place properly. So, it's a one-way thing where you give a quantum of knowledge, but the debating, getting opinions,
The meeting of minds isn't really there.
and then it's very difficult to sometimes to get the child to talk. But if you are in a class, you are forced to talk.
Right.
So then those skills, so the backward child will not really get the benefit out of this, although he would get certain amount of knowledge. Then we will have a little bit of an issue of getting real out of the students, and especially their skills, because this is a one-way thing. They will learn what the teacher teaches them. They will not be able to demonstrate their abilities for the teacher to pick their abilities and to harness them. So that type of things will go down.
Professor, all those schools have reopened. That does not mean that they will stay reopened for an extended period of time, given another surge in the COVID-19 cases in the country, and there is a good chance that schools will close down again. And if children are stuck at home again, or there are still students who are stuck at home without schools reopening, what is your advice to the parents of these children on how they should manage the children so that it will give way for these children to develop?
Yeah. So, of course, I think you have to make sure that the children are, following whatever their distant learning courses, and then through the internet or whatever means. But of course, you have to make sure that as much as you try to educate them, you have to look after their physical health. So, one of the most important things is that they should have a structured physical activity program which has to be insisted. I know that there is sometimes difficult to take them to an outside garden, or there may be lack of garden space, or then of course there will be some difficulty in taking to a ground or playground or a park or something. But of course, parents have to find out some sort of a way, at least even walk around the road, around the house or something like that, to make sure that the child gets adequate physical exercise. And then of course, we again don't recommend them to go on for long hours looking at the screen devices, and also not to be seated at one place.
Right.
There should be made some sort of a provision that they, at least every 20 minutes, they get up and stay standing for about about at least 2-3 minutes.
So with these distance learning programs in school being conducted for about 6 hours a day, how is that really possible?
I would sort of say that the teachers also make sure that they insist a break for the students. Okay, right, we stop for 2 minutes, stand up,
Right.
stand on your feet, stand on your toes, and exercise a little bit, stretch your hands, arms, like that. That type of a thing is very, very important. And because now the children are eating the same habits, and sometimes they may be eating much more than what they used to eat, and they are minimally exerting, so they will put on and they will have a lot of effects in the long run. As well as they also should have better to place their devices in front of a window or something where they can from time to time have a little bit of a far sight. They focus to a distant place, distant object, or at least have a good picture hanging in the wall in front of them with a good depth, because otherwise the eyes will also have issues.
Right.
So then also the important thing is that they should maintain the distance between the screen device. What is recommended is about 3 times the size of the screen. So if it is a 10-inch screen that they are using,
Right.
about 30 inches away from that, preferably at the eye level.
Right.
Because there will be otherwise a lot of strain on the
Brain.
neck muscles. So all those things, I mean, we have to adapt ourselves. We have to make sure, but we have to make sure that we take the precautions, whether we are going to stay and do online learning, or whether we are going to send the child to the school. It is not the normal which we experienced 15 months back. It is quite different. So we have to take that precautions and adapt and then move forwards.
Because this is, of course, the new normal. We will be back on Newsline after this short commercial break. Don't go anywhere. Stay tuned.
Newsfirst, Newsline.
Welcome back. You're watching Newsline on TV1. We're, of course, continuing our discussion with Professor Vikrantha, a senior professor in pediatrics at the Columbia University and consultant pediatrician at the Lady Ridgeway Hospital, on the effects that COVID-19 has on children and also the safety involved or the risks involved in sending children to school now that schools have reopened. Professor, we were speaking about those matters before the break. Moving on in our conversation, I'd like to ask you as to which age group of children do you believe has been most affected by COVID-19? Not in terms of only getting sick because of COVID-19, but affected the development of the children. Which age group is it?
I think age group wise, overall socially, education wise, all that, and psychologically, I would think the primary school children would be much more affected because they were sort of in a transition in their life. They were eagerly either going to start school or they were just started school, and from that point, so they would have a lot of hopes in going to school, making friends in new society, all that.
Right.
So most of that psychologically would have been affected, and this is an age where you want to play a lot. You should play a lot, and that also had been confined to a great extent. Then on the other hand, you can't have the even small outings, like going into the park or going on a trip or visiting your grandparents or someone. So I think that is one of. Then from the education point also, this is the age where you learn new skills, like maybe handwriting, doing handwork, things like that. So all that is now got affected. So my opinion is to a great extent, because this is not an age where you study actually. This is the age where you experience, learn. And older, junior secondary, senior secondary, at least you have a target, you have to know what to learn.
And you have an understanding of what should be done.
Here there is nothing. It is guided by the teachers, and most of the parents, I don't think we are empowered even. I must say, if I had small children, I am not empowered to teach them. So so my advice is you may have to create mini schools at home where the parents' involvement have to be, and more than insisting on learning material, I mean learning stuff, it is they should give opportunities to experience them.
Learn skills.
Skills, where handworking, discussions, talking with them, reciting poems, nursery rhymes, whatever, and try to get their skills out of that, drawing, things like that, while they are doing the other work.
Well, many children in Sri Lanka have already lost close to a year of their schooling life. And as you mentioned, the junior or the youngest children have been the most affected. Is there any viable mechanism or is there a possible way that we can maybe catch up on this time that we've missed?
Well, it would be very, very hard to catch up on this time, I would say. I mean, I'm not quite sure what the school authorities are planning on this, but of course they are trying to catch up with the work as much as possible. And then there will be probably cutting down on vacations to a certain extent, but that is also not very healthy thing. So they should convert whatever lockdown time periods, and even we know that if certain areas are being locked down, then naturally the schools will get locked down. So those should be converted into holiday time,
Right.
And then even the other schools are open, these schools may have, other schools are closed, then these schools have to
Right.
function. So they have to try to somehow or another match the contact time, what the child had lost with the school, and try to improvise a method and try to, because I think the whole of this year we may have to do a lot of catching up.
Right.
And hopefully middle of the year we will be able to breathe a little bit free, but I don't know what could happen when again coming to the end of this year, again the cold season comes up.
You said that the schools have to catch up on the contact time that they have. Would an extension of the school day really help in this matter?
Well, it all depends on how you...
Generally, junior
Back
students
to-
are in school from
Yeah.
7:30 to somewhere around 12:30, maybe making that time 3:30, 4:30?
Well, you can make it, but of course, when you are trying to do that, new things also now, can a small child come to school, have his or her meal, the lunch, things like that, also you have to see into those things, how we are going to make it up. So, but of course, many of the schools have midday meal programs. So those could be converted into a midday snack and give a little bit of long hours. So I think those all have to be taken into consideration, and look into how you can improve the contact time and give more opportunities for the children to learn and experience.
You were speaking about physical activity of young children and children in general. However, although schools have reopened, sporting activities at schools are still very limited because, of course, school authorities are trying as much as they can to limit contact between children. And when it comes to sporting events, that is really a contradiction as to how that can be done. How soon do you believe that sporting activities at schools
Well,
should
sporting
begin?
activities I don't think would be sort of competitive sports would go back in the same way unless in very, very limited fashion it happens, where almost no spectators, you screen the groups and keep them in isolation to a great extent, because there is always, because you can't play the game during daytime and in the evening send them to individuals' homes.
Right.
So there will be an issues, but of course physical activity programs could be conducted with minimum distance, with adequate distancing, like drill displays and things like that. So, but of course other crowding up sports activities may have to be held on for a little bit of longer period of time.
Right. So now there are sportsmen, of course, a lot of sportsmen in school. I'm not talking about small children, but children in their O-level years, their advanced level years. There are a lot of sportsmen who have missed much of their seasons because of this. And of course, this will have an effect on their future. When do you think sporting activities of that competitive nature could begin?
Well, I think at least it will take about another 1.5 months, if at all, for the school authorities to think about that. And I don't think that is one of the, I mean, true, it is important from individual's point of view. But when you are thinking about the society and taking it as a whole, it comes a little bit low
On the priority
priority list. So I think it is important that we start the schools going, get the brain society functioning, and then get on with that. But of course, my advice for those all sportsmen people is that you do not stop your physical training, but keep on doing the training as if you are having a match tomorrow, that
Right.
type of way.
So
that is
training conducted individually.
Exactly. So most of them, at least the physical fitness, certain amount of skills could be developed now. So those should continue. Those should not stop.
Well, there have been, as I mentioned before, only a very, very limited number of COVID-19 deaths among children. Children seem to be relatively safer than adults. But there have been a number of deaths here in Sri Lanka, and one death is a death too much. So speaking about the reasons behind how children really died of COVID-19 here in Sri Lanka, what were the main reasons?
Well, of course, I think some of the, mainly they get bad respiratory infections. And most of them are, if they are quite reasonably healthy and not having other individual, because although they are children, they could have some other defects, mainly coming from birth. So if they were having any sort of a background, defective lungs or any other system, then of course their chances of succumbing to the disease is much more higher. but I am not 100% aware of how many, of course, died and what were the direct underlying reasons other than the COVID-19. But of course, any illness, even a simple common flu, common cold can also kill anybody who is having other problems like underlying heart diseases, underlying lung diseases, things like that. But of course, as a primary killer in the childhood population, this virus is very minimum, I would say. So that's why, and majority of the children are totally asymptomatic. They don't show even a runny nose or a cough or anything. But they, if you test them, they will be positive.
Right.
So that is.
So the risk is mainly for the adults.
Exactly.
Now, there have been a number of cases that have been reported at the Late Ridgeway Hospital as well. So if a child is displaying symptoms of COVID-19 generally, what's the procedure like?
Well, excuse me, any child who is having, any child who is having any sort of a symptom should be taken to a doctor.
Right.
And if they go to a government hospital, it's much better.
Right.
Then at that point, they will be tested.
So, Professor, speaking about, of course, the quarantine procedure that, of course, everybody who displays COVID-19 symptoms have to undergo. Now, we know for adults they're quarantined separately, but when it comes to children, are they really quarantined separately? From which age really do they allow a guardian to go along with these children?
Well, children under 14 years are considered as cannot stay alone.
Right.
So most of the time they would be, all the time they would be accompanied by a bystander.
Right.
And so any child who falls sick, who is positive for COVID, would be sent for a special facility, and they will be sent with their parent. Mostly it is the mother who would accompany.
Right.
Even if the mother is negative, still we would send with the mother to look after the child.
Right.
So that is the normal procedure. So when it comes to quarantine, of course, that's a different thing where you send them to isolation, but most of the quarantine now happens within the household.
Right.
So if the parent is positive and the child is negative, of course, then the parent will be taken, but not the child. But of course, circumstances differ. If it is a nursing mother who is having very small baby, then of course those will be changed accordingly. But usually a child will be accompanied by the mother at the time of going to the hospital.
And that's all, of course, the time we've got for this discussion here on Newsline today. Thank you very much, Professor, for joining us on our show and clarifying these matters, of course, to the general public. Well, as always, as we remind you always, it is important for you to understand the risk posed by COVID-19 in the country. And just because the vaccines are here in Sri Lanka does not mean that there is any reduction in the risk of a person contracting COVID-19. So do stay safe, follow guidelines that have been issued by the authorities. Take care and God bless until we meet again.